Good afternoon, students. Today I am going to deal with the topic Information Education Communication. It's the last unit of second year Community Health Nursing syllabus. So in this unit we have a specific objective of definition of IEC, that is Information Education Communication, and aims and objectives and principles of IEC, role of community health nursing IEC. So, information, education, communication. These three words integrated and it is termed as IEC. Okay. Previously it was termed as health education. Actually, IEC is a latest or modified version of health education. So let me give some of the concept more about IEC. So IEC, the definition we can see. Okay, IEC can be defined as an approach which attempt to make or reinforce a set of behaviors in a target audience regarding specific problem in a predefined period of time. Okay. So it's an approach of giving information or changing the behavior of people. Okay. In this scenario, we can very well clear to understand what is this. So during this quarantine period, we are all locked down, we are all staying in the home, and we are curious to know about the information related to how to prevent the COVID-19 infection. So the best strategy is to isolate and stay in the home. Isolate in the sense, home isolation is the best method. And many information about how to safeguard our health in the sense like hand hygiene, maintaining self-protection, good nutrition and all. So all are targeted audience in this specific period of time. So this definition is very apt in this scenario. Okay, so we modified our behavior. Especially, we have certain norms like how to protect our health, especially hand hygiene. We may perform before eating or before cooking food or before touching textbook. These are the norms. But now we are doing frequently hand hygiene. Okay. Like whenever we are going out and coming back to home, by the time we are doing hand hygiene. So this is a modified behavior. Now we are practicing. So this concept is clear for I think. I am going to move the next slide. Definition, one more definition. Actually, IEC is the process of learning that empower people to make informed decision and modify behaviors to attain a better standard of health. Actually, it is a process of empowering people to know about the better standard of health in a way through changing the behavior, modified behavior. Through modified behavior, they are able to maintain a good standard of health. So it's a learning process. Okay, so and next we can see the concept more clear. You can see the IEC dynamics. Okay, information, education, communication. So in the middle one you can see education. Education is obtained through communication and information. Okay, this center one is a pool of information, that in the pool of knowledge that is gaining through information and communication. Okay, And also education is a great source of information on many facts. Okay, and this communication part is a link between education and information. So all these terms are overlapping or interrelated. Okay. So for example, about information. Information means any facts related to maybe a figure, maybe a count, maybe a number, maybe a socio-economical profile. For example, information about the population statistics, male female sex ratio. So that is an information we are getting from the census source. It's a pool. It's like it's a knowledge piece. Okay, a piece of knowledge. That is information. Then education. Education, we know that it is active knowledge. It's not a passive one. So learner and the communicator have to be active in mode. Then only the education will be complete. Otherwise, suppose teacher is active and students are not taking the notes or not taking down the notes, or they are not listening, then the meaning of education is no more. Then communication. Communication, it's a way or it's a method of spreading or disseminating knowledge or information. Okay. Then coming to the aims of IEC, or information, education, communication. So the first aim is to change the behavior, to change the health behavior of individuals, family and community. Okay. Next, to prepare background or basis for change in health behavior. Okay. So providing scientific knowledge, people will become aware about the need of changing their behavior. They will easily adapt. They will easily follow the instructions. They will easily follow the health behavior. Third one, to change the norms of community. As I said earlier, our community are following certain norms. Okay, so it is very difficult to change a norm, because norm is always concrete. Okay, it is difficulty to move or difficulty to change. Okay, but we can slowly change the norms through education. We can slowly change the. So for example, in this scenario, hand hygiene. Okay, everyone, even a small kid is following the practice. Okay, so through this IEC, we know every day we are getting information about the preventing corona infection. Okay, corona spreading. So the main strategies like hand hygiene. So now we can see every corner of the street, for example, in front of a hospital, in front of a shop, we can see a wash basin, and there we can see either a hand sanitizer or a hand wash. Okay. So people are following. Then next, to facilitate education for audience about public health and to create awareness in public opinion. Okay, our opinion, the education can influence the public opinion. So it have a large audience. So a large audience opinion can influence. Okay, education can have an impact of creating large level awareness. Okay. Then last one, to obtain social political support for health activities. So without health education, health activities, public health strategies, we cannot sustain, or we cannot succeed, or we cannot move. Okay, we need a social and political support, people participation is needed. Then only health activities will improve or it will succeed. So these are certain aims. Next we will see the scope or field of IEC in relation to health. What are the scopes? Okay, IEC, where and all it will applicable? It will applicable in primary health care. Okay, for example, primary health care. We know that there are certain elements of primary health care like medical care, health education, vital statistics, then immunization. For all we need information. Then only people will accept, people will adopt, people will follow. So primary healthcare area, IEC is essential or necessary. Then next one, prevention, control on communicable disease. Okay, so for example, now the COVID-19 is spreading. So IEC strategies is using to combat the COVID-19 spreading. Okay. And next, reproductive health, maternal and child health services. Family planning is family planning services. Okay, information about family planning methods, then all this knowledge can be disseminate or spread through IEC. Then family welfare services like IUD insertion, immunization, antenatal care, postnatal care, all this information we can give to this approach. The nutritional services, better nutrition, well balanced nutrition for all age group. Okay, how can we maintain good nutrition status, about the caloric value, about the advantages, about the cooking methods, all food hygiene measures, all this we can give through IEC. Then personal hygiene in a way larger area where menstrual hygiene, skin care, dental hygiene, all the area we can cover. So it have a large scope in the field of public health. Next, we can see the approaches of IEC. The approaches of IEC are mainly 5 level. First one is mass level, second one is community level, third one is group level, fourth one is family level, individual level. Okay, these are the different approaches. Mass level approach of IEC. What is mass level of IEC? So, mass level of IEC is health education we can give through a large people. Okay, for example, a general public. So, the education is done by using different mass media methods. For example, radio, television, films, health exhibition, magazine, newspaper, internet. These are different mass media, even social media like WhatsApp, then Instagram, Facebook, all mass level channels, mass level media of communication. We can propagate the information, okay, to a large extent of people. This is mass level. Then community level. Community level approach in health education. For a defined community, we can give the health education. Okay, so it is not only creating awareness, but also is helping people to understand their health problems, their needs, health needs, and how to implement them according to the need. Based on their need, we can give health education for a defined community, for a specific community. Then on a group level, okay, group level health education is that it is teaching or giving information to a specific group. We know that there are specific groups in our community like antenatal mothers is a group. Okay, we can target to those group and give health information. Okay, we can call them and we can give health education, especially in antenatal clinic. A hospital, they are having antenatal clinic. They